Hi, everybody. I'm Professor McBride, and I am a labor and delivery nurse and a maternal newborn instructor. Today, we're going to look at the acronyms VEAL CHOP MINE and how it helps us assess and determine interventions in fetal monitoring. So for this, we are going to use the word VEAL, the word CHOP, and the word MINE, and we're going to write them in a column. So the first one is the word VEAL, and it goes down, VEAL. This is what you might see on a tracing. If you see a variable deceleration, it has that abrupt onset where the heart rate drops quickly and returns to the baseline quickly and makes a V shape. E is for early. Early decelerations happen at the same time as the contraction. A is for accelerations. These are increases of at least 15 beats above the baseline and last for at least 15 seconds if the baby is over 32 weeks gestation. If the baby is less than 32 weeks gestation, these are going to be 10 by 10 instead of 15 by 15. And then the L is for late decelerations, and these happen after the contraction starts and returns to the baseline after the contraction ends. So that's the word VEAL. The next line is the word CHOP. The C stands for cord compression. The H stands for head compression. The O means everything's okay. It also can mean oxygenation. And then the P stands for placental insufficiency or placental perfusion. Then the final word that we're going to put in a column is the word MINE. The M is for moving the mother. The I is an intervention is not needed. The N means no intervention. And the E is to evaluate. Now these are going to come together and create a chart for you. So if we go straight across, the V from VEAL was variable decelerations. The C from CHOP was cord compression. The M from MINE means we should move the mother. So thinking about this, if a variable deceleration is caused by cord compression, moving the mom could relieve pressure on the cord. Next is the E for early decelerations. Early decelerations happen because of head compression for the baby. And intervention is not needed for this. This is a normal finding. Okay, as labor progresses, there's pressure on the baby's head. It can cause early decelerations or those decreases that happen at the same time as the contraction. Next is accelerations or those increases. This is a sign of oxygenation and we have no intervention. This is good. Remember, we need at least 2 of these in a 20-minute tracing for reactive and reassuring tracing. Finally is L for late decelerations. Late decelerations happen after the contraction, and it's a sign of placental insufficiency. This is the one we are the most worried about. This is the one that is dangerous for our baby. So in a previous video, we discussed what causes these, and we need to consider position, blood pressure, and contractions. So we need to evaluate why, and we need to do things that are going to improve the oxygenation, perfusion to the placenta, oxygenation for the baby. And so this is where we have to get to the point. Position changes first. Okay, maybe remember supine hypotension, maybe changing mom's position will help perfuse the placenta better. Oxygen we can consider. It is not a first line choice, but it is a consideration if, especially if mom's oxygen saturation is low. IV fluid will support blood pressure. Notify the doctor. We might need to do a C-section because the baby is becoming hypoxic. And then the T is tocolytics and turn off the oxytocin. Let's decrease the contractility of the uterus so we're getting more blood flow to the placenta. So that is VEAL CHOP MINE. I hope this was helpful. Please reach out if you have questions.